10 weird signs that show you're having liver damage. Your liver is one of the most critical organs in your body, working tirelessly to support your overall health. It performs over 500 essential functions like detoxifying harmful substances, digesting food, and storing nutrients. However, when the liver starts to encounter problems, it doesn't always make its distress obvious. Instead, it may present strange, subtle symptoms that many people might overlook or misinterpret. In this video, we'll walk you through 10 weird signs that might indicate liver damage. By the end, you'll better understand these symptoms, helping you take action early and maintain better health. Let's dive in. Before we jump into the signs, let's take a quick look at your liver and why its health is so crucial. The liver is located on the right side of your abdomen, just under the rib cage. It plays a central role in processing nutrients, detoxifying the blood, producing critical proteins, and managing your metabolism. Despite its resilience, the liver can face damage from various sources like excessive alcohol consumption, obesity, viral infections, or exposure to toxins. The tricky part is that it often doesn't show immediate symptoms when something is wrong, largely because it has a remarkable ability to compensate for damage until the situation becomes severe. This is why it's so important to know the early, unconventional signs of liver problems. Let's explore them together. One of the most common and yet most overlooked signs of liver damage is constant, unexplained fatigue. Feeling tired after a busy day is normal, but if you're persistently exhausted even after proper rest, your liver might be struggling. When the liver isn't functioning well, toxins can build up in your bloodstream, sapping your energy and making you feel worn down. Chronic fatigue is often one of the liver's earliest cries for help. Scratching an itch once in a while might not seem concerning, but persistent, unexplained itchiness can indicate liver issues. When your liver is damaged, bile components can accumulate in the bloodstream and skin, causing irritating sensations. If you find yourself constantly scratching with no apparent allergic reactions or skin conditions, it's worth investigating further. Jaundice is one of the most recognizable signs of liver trouble. It causes the yellowing of the skin and the whites of your eyes. This occurs because the liver isn't processing bilirubin, a yellow pigment that forms when red blood cells break down. While jaundice is a clear indicator of liver dysfunction, it could also signify other medical conditions, so it's crucial to consult a healthcare professional if you notice this symptom. Have you noticed your urine turning darker, even if you're well hydrated? This may be linked to liver problems. A damaged liver may cause bilirubin to build up in your system, which can then be excreted in urine, giving it a tea or cola-like hue. However, keep in mind that dark urine might also point to dehydration. If it persists despite drinking plenty of water, consult a doctor. If your abdomen appears bloated and feels tight, particularly if this happens suddenly, it could be caused by ascites, fluid buildup in the abdomen. This occurs when poor liver function affects protein production and fluid regulation. While bloating may have a range of causes, recurring or persistent abdominal swelling is a significant red flag for liver issues. Feeling constantly nauseous or experiencing frequent vomiting is another potential sign of liver damage. When the liver can't properly filter toxins or manage digestion, your stomach may react with discomfort or queasiness. Occasional nausea isn't usually a concern, but if it becomes a persistent issue, it's worth checking out. A declining appetite is a commonly overlooked symptom. If you suddenly don't feel like eating, and this lack of hunger continues for several days or weeks, your liver might be to blame. Liver damage can disrupt digestion, making the body less responsive to hunger signals. This might also lead to unintended weight loss, which is another symptom to be aware of. Swelling in the lower body, especially the legs and ankles, can be tied to liver damage. When the liver isn't functioning well, it can cause fluid to accumulate in the extremities due to impaired protein production. This type of swelling, known as edema, might come and go but shouldn't be shrugged off if it happens frequently. Do you find mysterious bruises on your body, even when you can't recall injuring yourself? That could be a sign that your liver isn't producing enough proteins essential for blood clotting. Without an adequate supply of these clotting factors, you'll likely bruise more easily than usual. Your brain and liver are closely connected. If toxins build up in your bloodstream due to liver dysfunction, they can eventually travel to your brain, causing cognitive issues like confusion, poor memory, or even difficulty concentrating. This condition, known as hepatic encephalopathy, is a serious sign that demands medical attention. These symptoms might seem unrelated, but they are connected through the liver's vast and varied functions. What's tricky is how easily they can be dismissed or attributed to other minor issues. For example, fatigue might be blamed on a busy schedule, and bloating might be seen as poor diet or digestion. It's crucial to approach these signs holistically, considering if there's a possibility of liver damage, especially if you have risk factors like a history of alcohol use, obesity, hepatitis infection, or exposure to toxins. If you recognize one or more of these signs in yourself, don't panic. Instead, make an appointment with a healthcare provider to discuss your symptoms. A doctor might recommend a series of liver function tests or imaging scans to confirm whether your liver is under stress. The key takeaway is not to ignore persistent symptoms. Early detection of liver problems can vastly improve outcomes and prevent complications like cirrhosis or liver failure. While you can't reverse all types of liver damage, protecting your liver by adopting healthy habits can minimize risks and slow progression. Here are some tips for better liver health. Adopt a balanced diet. Eat plenty of vegetables, fruits, whole grains, and lean proteins. Avoid processed foods, sugary drinks, and excess fat. Stay hydrated. Drinking plenty of water supports your liver's detoxification efforts. Limit alcohol consumption. Excessive drinking is a leading cause of liver disease. Reducing or avoiding alcohol altogether is one of the best things you can do for your liver. Maintain a healthy weight. Obesity is strongly linked to non-alcoholic fatty liver disease, so regular exercise and a healthy diet go a long way. Vaccinate against hepatitis. Vaccines are available to protect you against hepatitis A and B, both of which can harm the liver. Avoid harmful medications. Overuse of certain medications, like acetaminophen, can strain your liver. Always follow dosage instructions and consult your doctor if unsure. Your liver is a resilient organ, but it's not invincible. Recognizing the early and unusual warning signs of liver damage can make a big difference in preventing more serious health issues. From unexplained fatigue to yellowing skin, these signals shouldn't be ignored. Be proactive about your health by seeking medical advice if these symptoms persist. Additionally, adopting liver-friendly habits can help ensure this vital organ remains in peak condition. Let this video be your guide to understanding your liver's subtle cries for help. If you found this information useful, share it with someone you care about. It could make a big difference in their life. After all, the more we know, the healthier we can all be.